All right, so here's a video to help with your knees. If your knees are all tight and sore in the morning, here are ways that you can get them going. First of all, just marching in place, bringing that knee up to that chest. It's just gonna get blood flow to those knees, getting everything kind of woke up, getting everything moving, okay? Most of the problem is there's blood flow. We don't have enough blood flow to that area. So going on a walk, doing some marching in place, doing something to get the blood flowing to that area after you've just been sitting for a while or have been sleeping for a while. But the thing that I want to do, we're gonna, some active stretches. We're gonna put our feet flat on the ground, we're gonna be kneeling, and we're just gonna try to touch our butt to our heels, try to stretch out all the ligaments, all the tendons, all the muscle tissue that's around our knee, okay? So we're just sitting that butt down, and then driving back up. Big squeeze of those glutes at the top. All right, we're not bending through that back, we're just squeezing through that glute. So down, then big back up. If you feel like this is too easy, you can try to stay tight to that belly and lean back. And squeeze back up to your quads. Lean back. Squeeze back up to your quads. I can feel my knees having to flex real hard to pull me back up. That's going to get a lot of blood flow. It's going to get a lot of tissue moving through that joint. Not a lot of tissues will be moving around that joint. The next thing I want to do is a deep forward lunge. So we're going to be standing. We're going to take one big step forward, and we're going to try to put our butt onto our heels. Okay? So this knee is getting a lot of extension, a lot of movement right here. This knee back here is going to be off the ground. I'm trying to get my butt down towards my heel as best I can. And then relax, step on back, step on up. Then you'll hit the other side. Big step forward, hitting that butt towards that heel, keeping that other knee off the ground. Getting blood flow to that area. Relax, come on back, then stand on up. All right? So for those, march in place, get going for like a minute or so, get that blood flowing. Then we're going to do the kneeling, sit back on the heels. That's going to be do 20 reps on that. If you do the lean backs, do 10 reps on that. And then if you're doing the forward lunge, do 5 per side. Hold that deep lunge for a little bit. If you're having trouble getting really deep into that lunge, you can step up onto a stair or up onto an elevated surface. That'll help that hip kind of get a little more motion and get your knee moving in a better direction. Try to get that knee out in front of those toes as far as possible. All right, give those a try. Let me know what you think. Thanks so much. Talk to you soon.